So I'm Harry Hochheiser. I'm the director of the Midas Coordination Center. And what I wanted to do today, this came out of discussions we had with some of our steering committee, was to really just take a little bit of time to give some folks in the community an update on what we've been doing recently, a little bit of show and tell on some of the work that we've gotten done, and hopefully try to go through that in the first 20 minutes, half hour or so. And then to have some time to really hear from you as Midas members. Any thoughts on what I show you? Any thoughts on what you need for the Midas Coordination Center, or how we can help you with your research or infectious disease modeling efforts in general? And really just to use this as an opportunity to have a little bit of conversation about where we should be going in the coming months in the next year or so. So I'm hoping we can get some dialogue going after that. We've got a relatively small group right now, so I think we can be reasonably informal. I'm going to present the slides, as I said, and Stephanie Shadbolt's going to help me out by hopefully monitoring the chat and letting me know as there are questions. And hopefully we can, as I said, have a little bit of an instructive time here, but please let's make it informal. So speak up. If you've got a question as we go, let's have a conversation and not just a lecture. We have enough of those as it is. I'm sure everybody does. So with that, I will share my screen and try to get started on our update portion of what we're doing here. So with that, can folks see my slides okay?
Yes.
Excellent, thank you. Okay, so as I said, my name is Harry Hochheiser, director of the Midas Coordination Center. We think of our efforts really sort of falling into four areas here: members in communication, outreach and training, data and computation, research on reproducibility. I'll give you a quick summary of each of these. And again, happy to take questions, and I'm going to do a little bit of show and tell here. So in terms of members in communication, we see a continued growth in the membership. I'll give you some numbers in a minute. We're having our weekly COVID-19 spread in the US forecasting calls with CDC, and we thank Matt Biggerstaff and Mike Johansson for working with us on this working with us to make these calls a useful touch point for the community to talk about the state of data and what the state of the pandemic and other interesting and important trends in data. We've got a student group that's been meeting and then forming a mentorship program. We have a Latin American group. You may have noticed that our webinars monthly, we have Spanish translations, and we've also got a Portuguese translation and a Spanish translation of the website. We revised our Contact Us page. We're planning the Midas 2022 meeting. You hopefully have seen about that. It's going to be in person on September 7th to 9th at the Bethesda Hyatt, and virtual on September 23rd for a follow-on day for those who can't make it in virtually. We've had, I believe, over 90 submissions that came in this week. Submissions were due earlier on, I think on Monday. And so we're hoping to start the review process soon, but we're excited about this meeting. We think it'll be a nice success. On the coordination site, midasnetwork.us has, roughly around 2,300 visits a month. So we take that as evidence that people are finding some material that's useful there. A couple of other things we've been up to along these lines, but let me just give you the numbers first here. You can see here from 2019 to 2022, we've grown steadily here. There was, of course, a huge bump with the beginning of the COVID pandemic, but we've sustained that, having grown by more than 10% from 2021 to 2022. And you can also see we get a good mix of people from different career stages, from different sources of employment, and regionally having a nice chunk of international people as well. So we like to think that this is not necessarily fully representative, but a broad sample of the folks around the world working in infectious disease modeling efforts. We revised our weekly update. Hopefully you all have seen this. If you're not seeing us, let us know so we can try to improve our work around the spam filters. Here I am going to give you a little bit of a demonstration. We built this online visualization of the Midas community to try to begin to see who is involved and how they connect to each other. So let's see here if I can pull this up. And hopefully you can see this on my screen now. Can you see this? You got it? Let me put it to the full screen here. So, if I want to search for somebody here, I've searched for Cecile Viboud, who many folks know, and you can see how she's very centrally located here. But I can then scroll in, I can see some other people and how they are connected, and for any given individual, the list of their collaborators in the network on the side, and then in the graph here, so I can begin to see who is 2 hops away, for example, and I can use this to get an idea of who's working where and what's going on in the consortium. So this is just a preliminary effort. We are currently right now working on extending this to include additional information such as funding and papers, so that we might be able to show how people relate to each other, not only through collaboration, but through the broader question of topics. So I can say who in the network is working on similar topics to, say, the keywords I'm interested in. And so this is something we're going to try to put together over the course of the next year. From where is the collaboration information sourced? That is a great question. We have all of the information about the Midas members on our website. We also have information on papers. And so we're using this to figure out who's collaborating. That said, I'm certainly up for suggestion for ways we can make this viewpoint, this visualization, excuse me, more useful for the community. Moving along. In terms of outreach and training, we've also put together a collection of online educational resources that is available on the Midas site. These include both sort of MOOCs or online tutorials, interactive resources, and some pointers to more traditional, familiar, shorter, long courses. We have a page of funding opportunities so that people can learn about what's out there for research funding, and similarly for job opportunities. A lot of the job opportunities tend to be at the moment from academia, but that's just a matter of what we get in. So if you have funding opportunities or job opportunities you want to share with the community, please let us know. We'll get them posted. Similarly, if you're looking for a job or for funding, go take a look and see what you can find. We have also had some targeted webinars, including the CDC Professional Effectiveness Fellowship, to try to get the word out to trainees to know about what they might want to do in terms of career opportunities. I mentioned the student group in the mentorship program. We also, through a supplement that is wrapping up, funded my COVID urgent grants, and we funded 12 different groups to do with some really nice COVID work. I can provide some details about that to folks who are interested. We also provide financial support for Midas members to learn about or participate in either training or the research or research conferences. And so here's an example of the number of people and the events that we've sponsored recently. We held this past January the annual conference to increase diversity in mathematical modeling and public health. This was run by many years out of Mark Lipsich's group at Harvard. We ran it virtually in 2021 and 2022. We had a small but good group of participants here. You can see pictured. We are hopefully going to run the 2023 meeting in person is the plan. And again, we'll be working with Harvard again on that in the fall to put all of that together. We have our monthly webinar. Many of you hopefully have been participating. Just to mention, We have it the last Friday of most months. We're not having it this month because of the Memorial Day holiday. We have recordings on YouTube. Here's a list of some of the recent talks. And we've had some very interesting talks. And one of the things that I'm personally pleased with is that they've not all been about COVID. You can see from the titles here, although certainly that's on the menu. We've heard about a lot of a broad range of infectious disease modeling topics lately. In terms of data and computation, I'm going to show in a second the Midas data catalog that we built and put online as of last September, which has more than 300 resources with curated metadata and faceted search that allows us to search by type, location, and date. We are also currently working on the Midas COVID-19 Public Health Archive, which is an archive that we've been essentially building for the past 2 years of scraped and regularly updated data from public health sources and other official sources about COVID cases, hospitalizations, deaths, et cetera. We have over 1,000 resources that we've been monitoring regularly for the past couple of years, grabbing the data, storing it sometimes in raw form, whether if it's images or PDFs, sometimes in CSV files, sometimes in JSON, essentially whatever we can get out of it, and curating it, developing metadata. We're going to have pages for browsing and downloading this data, and it will be accessible through the Midas data catalog. So just a quick transition now to show you the data catalog. I'll pull it up right here. You can see here we have the locations, we have topics, we have types of data, and I can search here. And so I'm looking at both demographics or individual cases. I think this is in North America, for example. Oops, oh boy, love live demos. Let's see if we can start over here. Okay, so I have 303 entries. If I filter to North America, I can see that it goes down to a smaller number, and then, oh, okay, there you go. So we're having some bugs at the moment. My staff programmer who's on the line is probably cringing at the moment, but well, generally it works better than that. So please take a look and we will get that going. Once again, we'll look into those problems. That's the last demo for the day. The rule is once you get one blowing up, you stop. We're also taking some selected sets of COVID data and converting them to the Project TICO format. Project TICO is an effort that digitizes large amounts of public health data and put them into common formats. And so we'll have a bunch of COVID data in those common formats soon, which will allow for integration and access across different data sets that wouldn't necessarily previously have been quite so easy to integrate. And those will also be available soon through the Project TICO website and through the data catalog. We've been providing technical support for the Scenario Modeling Hub. The Scenario Modeling Hub is a group of folks looking at COVID, potential outcomes of the COVID pandemic under different possible futures involving, say, for example, different types of vaccine, efficacy or waning, the emergence of different variants. And there's now been 13 rounds of projections ranging over scenarios that look anywhere from 3 months to 12 months out into the future. We're working on the 14th round, which will be taking place sometime in June. And we have data from all of these projections from multiple teams up on the COVID-19 scenario modeling hub.org site, which is getting a fair amount of traction. You can see here more than 24,000 views a month on average. Finally, we have high performance computing. We have HPC resources available to the Midas community upon request through Google Cloud Platform. We provided over 86,000 CPU hours to Midas members, and we really have what I would consider to be a concierge service for this. Kim Wong, who was on the line, yep, he is still on, from the University of Pittsburgh's Computing Resource Center, helps us with this, and we really provide a lot of hand-holding. So if folks come to us with the need, They can tell us what software they need. They can tell us how they want to run it and what sort of compute they need, and we will help them put it together and let them use that for their infectious disease modeling work. So if you have the need, please do get in touch. We would love to help you with that. I mentioned the data catalog. That was a screenshot. We didn't get to see this because of the bug, but for each entry in the data catalog, we have a whole page here with some description, with a screenshot of the home page, a link to the original page, some time frame to tell us when the data was last checked. And over here on the side, you can see some metadata that describes what's in the data set. So we are working on trying to make that data more available and more useful to help people have a better chance of finding out what they want. Oops, excuse me. So in terms of research in reproducibility, this is something that we've been putting a good amount of thought into. And really the question gets to be, how do we take infectious disease modeling research and make it more reproducible, reusable? And at the moment, I don't want to get into what we mean by reproducible, because that in itself is a bit of a loaded term that people can debate in various ways. But just for now to say that we're looking at the question of how do we increase that reproducibility. One of the things we're looking at is using reproducible workflow tools, and working with some colleagues here at the University of Pittsburgh, we've been using the Occam framework, which is a reproducible workflow tool to use that to provide infectious disease modeling workflows and allow them to be reused and compared. And we're hoping to get this, at least a demonstration, to be somewhere that we can show to the Midas community in the near future. We've also been looking at trying to figure out how to describe data in a way that will make it more reproducible and reusable. And so we've developed an ontology for description of the types of information we'll see in COVID data. And that is actually what is driving the data catalog that I showed you before. And so we can talk a little bit about that if you're interested. We developed a list of best practices for software and data sharing for infectious disease modeling research. This is up on the Midas Coordination Center website with additional details. This is just a quick summary. And we also have some references from the literature to sort of give the background for all of these recommendations. This right now is something that we're trying to think about how we can make this more useful and provide better guidance so that people in the community can adopt it and try to bring it into their own publishing and their work so that people know what they need to know about the software and the data that's being used to build models to, again, increase the reusability and the reproducibility of the results. I mentioned the Midas data ontology, which is built on an earlier related ontology called Apollo SV. And we can really describe things at a couple different scales, molecular and population. We have different digital object types. And then we have a number of different topics here, including behavior, case counts, ecosystem data, climate data, control strategies, diagnostic tests, health system capacity, media modeling, mortality data, et cetera, and a bunch of others. This is really something we developed inductively as we were going through the 300 plus data sets that we curated through the data for the data catalog. We essentially started by developing or identifying descriptors to characterize these data sets, which we then grouped into hierarchical categories and used that as a basis for this this nomenclature. This is all right now available on that GitHub site as an OWL file. It's also browsable on the Midas Network site. Something, again, that we can certainly extend and expand and work with the community to increase the utility for the rest of the work. So that's really the quick update. I want to thank the staff here. We've got a great staff of folks who have made this happen. I won't read off all the names, but really all the collaborators at these institutions, and the staff folks have been really hugely helpful. And with that, I particularly want to note Jessica Kerr, who left at the end of April and has been replaced by Kristen Kropf, who works with me here in the Department of Biomedical Informatics at Pitt. And so she's a great person to talk to and still getting up to speed, but she's already been a huge help. And everybody here has really contributed in a very big way. So it takes a lot of work to get all this done, and we appreciate all the help. With that, that's my formal presentation. I just want to leave you with these questions. What can we do for you? What are the challenges you're facing? What are the next big topics? What should we be thinking about? And how can we build on these efforts to sort of move the field forward? Those are my questions. I'm happy to take any questions about what I presented, but I'd like to just have some open conversation about any of these topics. So thank you for joining in, and fire away. I'm going to stop sharing my screen now, but we can certainly bring anything up if anybody wants to see anymore. So if you have a question, please speak up, put something in the chat, whatever you like. And in the meantime, yes, Remy, please go ahead.
Okay, hello, good day, everyone. Can you hear me, sir?
Yes.
Can you hear me, sir? Yes. I'm having some issues with my research work because I've been working on the effect of vaccination on tuberculosis, and there's one I'm working on presently. But when it comes to stability, in finding the stability of the compartment, stability of the equation, I've been using Lyapunov function. I'm having problem with that Lyapunov function in testing for global stability. So I need assistance in that area. Using Lyapunov function to test for global stability of the disease model. Yes, because because normally I've tested for the local stability and all the value of the agent values, all the agent values are negative on my model, but I'm having problem with Lyapunov testing for global stability. So I think that is the major challenge I'm having in my model. Thank you.
Okay, so that's an interesting question. I'm hearing a request here for help in models that may not be working the way they would be expected to work. And I think that's a great question, and that's something that we haven't really thought about as a coordination center, but which we certainly could consider would be to have some sort of a question and answer session or section on the site, perhaps, or something where people with difficulties might match up with other people who might be able to help them with those difficulties. I don't know that we can get into the details of your question right now, but I'd also say if anybody feels like they might be able to help Remy, then please do get in touch and use the chat to make an introduction. But let me see what we can do here. That would be, I think that would be great to see if we could find somebody who you might be willing to talk with you to see where things are going wrong. So if anybody's interested, please let us know. Wilbert, you had a question or comment?
Yeah, thanks, Harry, for the overview, and it's really great. And I just wanted to express my gratitude that taking over the center about a year ago and having led it and continued it to such a fantastic, seamless way for the community as that's continued. That's really fantastic to see, and also for the team that's working with you. But I also had a specific question. You mentioned so the data catalog has moved forward and putting the resources up there. And I know how complicated and difficult it is to kind of pull that off, but also to continue it. So what are your thoughts for that catalog in terms of the curation effort? Are you going to continue it? And also any ideas of what's going to be required to keep it up? And in terms of effort and just how much work it is. And then also, there has been a whole lot of work on COVID. Clearly, it's taken up a lot of energy and work. Are you already with the center and the network moving into more traditional infectious disease work again, or is it still mostly heavily focused on COVID?
So those are, of course, several big questions, and I should take this opportunity, of course, to acknowledge Wilbert's work. You know, Wilbert was a director at the center until he left to take a position with NIH at the end of June last year, and so I appreciate the foundation he laid. You're right, it's a fair amount of work to do this sort of curation, and we have this number of data sets that we've manually gone through, and I think it is a good foundation. It is all on COVID. I mentioned the public health archive where we've got these that 1,000 or so resources that we've been tracking, and we will bring those online soon. Those also have a lot of metadata, and that will increase the volume here. But the real question of sort of what can we do moving forward is a good one. The COVID data, of course, saw this explosion of a large number of resources that burst onto the scene in a very short amount of time. And that was never really going to be a sustained kind of a thing. So what's on our side is the assumption, which I think is reasonable, that the emergence of new data sets is not going to be what it was 2 years ago, at least for COVID. So we are still curating additional data sets as we become aware of them. Sometimes they're reported to us by folks in the community. Sometimes we come across things that we see on our own work that seem like they should fit. So we'll bring things in as necessary. Moving beyond COVID, I think that's actually very much something we should be thinking about, and we haven't really gotten very far with that yet. But there's really no reason why we couldn't, and I would think one of the places that would be good to start would be, for example, with the public health data sources that we have been looking at, which might also be tracking flu, for example, which would be a natural thing to bring in there. So another point that I will make, which is something we haven't given a lot of thought to yet, but I think that we should, would be to enable community curation. So essentially, if somebody in the community identifies a site that has interest of value, we might ask them to complete a form to describe that data, to collect at least a good chunk of the metadata that's available, and then we might be able to get it up onto the catalog with a lower amount of effort on the side of our staff more easily. Because if the metadata is halfway there or 2/3 of the way there, then it might be easier to add it on. So that's something we could definitely keep on our minds as a possible future effort. I don't think it necessarily has to be very hard to do. I see a question here in the chat from Anuj Mubai. Linking collaborations between industry and academia. That is a great question. We've definitely had some conversations. We've had some people coming in from not necessarily quite industry work, but some of the think tanks that are sort of in between. So we've had speakers in webinar series from RAND and from RTI. I would certainly welcome a discussion from anybody from industry who is interested in collaboration or thinking about how to make ties with academia. Certainly, if there are folks in industry who have job positions or funding opportunities, we'd love to see them on the site. But in terms of anything more specific and concrete, like an active research contribution, I'd be very much interested to hear that. And I think I can commit pretty easily to say that if there was demand, we could have something, just as we have funding and job opportunities right now, we could add a site for collaboration opportunities. I would love to have some folks from industry just talk about what this work looks like from an industry perspective and to say what's going on, because I know I'm not terribly informed about that perspective. And so if there's anybody out there from industry who wants to give a webinar, please let us know. We will get you on the schedule. Absolutely. Not to put so much to put the Anuj on the spot, but can you speak to anything that you have in mind there that would be useful?
Thank you, Professor. Well, I was in academia for a number of years, and I just recently moved, and I was just wondering if there are any things that I could help you also with. So I'm working for a public health company, which is basically a startup company, and I'm leading a group on infectious disease modeling there at a global level. So I mean, I just wanted to discuss if there are any opportunity that has already been carrying out from the Midas group. I've been attached with Midas informally, formally in some sense for some time. And I was a faculty at Arizona State University before that.
Okay, well, I mean, if you're, as I said, if you have something you'd like to present to the webinar, we'd love to hear that. And
Sure.
I'm certainly interested in any other suggestions that folks have, because I think there's definitely going to be a bias that will continue in something like Midas towards academia. If you caught the numbers, the academics are the largest chunk of our research, but I certainly would not want to in any way dismiss or devalue those folks who are not in the academic world, because there's a good perspective there that needs to be considered, and I'm happy to do what we can to try to figure out how to build those bridges.
Absolutely, thank you. I mean, I will look for it, and I will share with the rest of the, contact person, and something might work it out in some directions probably future.
That would be great, fantastic. I think Robert has a question or a comment. Let's see, Robert, can we unmute you?
Yeah.
Excellent, thank you.
Yeah, similar to the previous question, I'm just interested in establishing collaborations. I'm new to the Midas network, heard about it. Some of my work in the past has been more on the individual level. So I'm looking at the Midas catalog, the link that was sent in the chat room. And so I've done stuff more with behavior and contact rates, again, more on the individual level, not quite on the level of populations and, and networks. But I'd like to move into that area. And I know you have a student mentor program. I just don't know if you have a way for people to kind of get started in the network that are already professionals. I just moved to George Washington University, so I'm first year here, and I'm, it gives me the opportunity to set a reset button from where I was previously. So I'm thinking about, broadening my interests and seeing where my skills can take me, and I'm just wondering if you have advice on how to sort of start the collaborations.
Yeah, well, that's a great question, and you definitely you're following a thread from the prior from the last person who spoke, Anuj. To a certain extent, this was one of the things we were hoping that the visualization would help with, would begin to get an idea of who's doing what in the field, and I think again we're just scratching the surface there. So that's one area that would help. I think looking through our list of members and our list of papers, you can also get an idea there of who's doing the work. That's not quite the same as meeting the right person. I would definitely encourage you, if you can, and at GW, you should be able to make it down the street to our meeting in Bethesda in September. Will be hopefully a really powerful time for networking, and I'm really excited about that meeting being a good opportunity in a way that we haven't had in a couple of years to get that sort of discussion going. But as I said, I'm perfectly willing to consider the idea of the collaboration wanted kind of an exchange on the Midas Coordination Center site. That's something we could do with a relatively low amount of effort and could be useful. Much of what we do here is trying things out to see what sticks. And those things that we can do without a lot of work and just try it out, the cost of lack of success, I won't say failure, but if it doesn't take off, there's not much loss there. So
yeah,
that's exactly why we're having this conversation, is to try to get suggestions like that. So we'll definitely give it some thought.
yeah, thank you. Just to make a comment on the industry collaborations. So I was previously at another university, and there was someone in infectious disease that was, getting the grants, and I was helping on the computational side of things. And a lot of the grants and the, sources of funding she was getting was from industry. And it was things like people making, coatings for infectious, for surfaces in hospitals, or hand sanitizer companies, or people, developing, new techniques in terms of UV light and stuff like that. So it was a lot of industry on, maybe in hospital settings. So that's one source of industry that I've worked with before, sort of indirectly, just to put it out there.
Okay, that's good to know. I think Joelle Adams.
Hi, my name is Joel Adams. I'm an infectious disease epidemiologist at RTI International. It's a nonprofit research institute. And I do a lot of modeling of COVID and HIV. And one thing that I've noticed and kind of have always looked for assistance with is, how do we translate model findings to the public in a way that the public is receptive to and understands, A, what created the model, what went into it, but then B, what they can do action-wise that is informed by those model findings. And as PhD trained epidemiologists, we don't always have the best or know all the communication skills, or working with the media, or making our model findings translatable. So I think having like a seminar or a series or a workshop on how to work with the media, how to work with people to communicate your model findings would be really useful. And that may have already happened, I'm not sure, but I think especially right now, it's something that I could see being really important moving forward. Thank you.
Yeah, thank you. We've heard that comment from others, and it's an interesting comment to make. And I'll say, first of all, that as somebody, I've only been really part of the Midas network for a little more than 2 years now, so I don't have the history that some of the people on this call may have. But one of the things I've been told is that, well, NIGMS, therefore Midas, doesn't like decision science. They don't like to go beyond the modeling. But yet, I've heard from several people involved in the Midas community that, the question of not just how to build the models, but how to communicate them, what do we do with them? How do they have an impact, is a question that needs more focus and more discussion. And I think that really resonates with me personally, at the very least. So yes, I hear what you're saying, and I agree, because why are people doing these models? It's not just an exercise in the mathematics, but it is in some sense, hopefully, to inform decision making. So is there a role for us to think about how we can look at the question of communication and policy, and not to say that we want to get into those worlds, because yes, that is going a little bit far afield for some folks, but to think about what can those fields tell us about how models might be more useful, and what can we do with models to bring into those areas. So I think, even if I'm not going to convince NIGMS to say we want to get into decision science and policy, I think it is a question of saying, what does it mean to look at modeling from a viewpoint of how does it become more well communicated, more useful to people, and more actionable? These are good questions. We're trying to get some people from the press into participate in the Midas meeting, for example. And so that's something I'm working on now. There was just a webinar earlier this week that was done by some folks at NIH on sort of health communication. And so there are efforts to try to look at this. A lot of it, of course, comes from a variety of different perspectives that are not infectious disease modeling, but I would be very happy to talk to anybody about how we might move on with these efforts. And yes, Robert, maybe it's about health behavior, health promotion. And so it's that question of, again, who you're communicating to. These things are going to be very different.
And I think one thing that might be really helpful too is, we're used to doing academic presentations and speaking to others who have a lot of background in what we do, but how do we present to different audiences? And then also, how do you translate some of your model output or some of your the ability to actually work with the model in ways that are accessible to the public? So not everyone's going to be comfortable going on GitHub or downloading the code. How do we create, dashboards and simple widgets and things that people can really access and use? I think we have an unprecedented opportunity now that people have seen the advantage and the utility of modeling through the COVID pandemic, to then translate that to having models be informative for health outcomes across the board. So it'd be wonderful to work together as a network to realize how to kind of take advantage and really use that opportunity. Thank you.
Yeah, thank you. And I agree. There are a lot of opportunities there and a lot of challenges. Because in some sense, to do this at scale, I would argue it would really require bringing in people from different backgrounds and with different expertise that goes well beyond what we usually think of as infectious disease modeling. Because you're really talking about communications, data presentation, a lot of other fields there that come to play. And yet, if we don't engage with those fields, we're missing out on opportunities. So, I can try, and Ravi, our program officer for NIGMS, is on the line. So I know he'll hear me saying this. I can try to push in those directions, even if I can't change the way the leadership of the NIGMS thinks about it. And so this is discussions that we can have as a network of discussions I can have with Ravi and the folks at NIGMS. And I think these really are important questions. So,
can I also, Professor, ask one more question in that? Just following up what Robert was discussing about the catalog that you have on the website of Midas. Are the data sets that are there, and I have not checked it, pardon asking you a question without checking it.
That's okay.
Is on alternative data as well, or it's only coming from a surveillance data sets on the platform?
Yeah, they're coming from all sorts of different sources. So these are not just, say, public health sources. It's really anything we found out there that looked like it was sort of credible and interesting. And you can see the range. It's really quite broad. Certainly, we want to do some due diligence with any data set to make sure that it is credible. It claims it shows what it claims to show and all of that. But we're not in this data set taking a huge filter out there to say we are going to limit this only to things who come from some small set of folks. But yeah, I think that's exactly the kind of thing that we want to get at here, is also to understand the breadth of data that's out there, because so many different data sources about behavior from the social media, from the environmental things that really may not have been available 10 years ago, for example, I think are going to be increasingly more useful for modeling and for understanding behavior at different scales. And we need to at least be aware of those data and to think what they could do to help the models.
Thank you.
Other comments, questions, criticisms? This is where I try to get good at the the awkward silence for a minute until somebody feels compelled to speak. So I will then throw out my own question then to sort of promote that a bit, is to say, one of the things that we have found that motivated this session today is just that it's hard for us to get feedback in terms of the utility of what we are doing. We have a steering committee that met last month that is going to provide some feedback. They are, in their own way, I think, biased, and I don't mean this in a bad way, but just in the sense of they are folks who tend to be known in the community and people who we know of who were asked and who volunteered for this position. So we know that they can't be representative because they're only a small group. So through this town hall, we're hoping to get some feedback. I mean, you've already had some very good suggestions about what we might do to help things move forward. How do we better reach out and engage more people to find the other needs and the other concerns that are out there? And I realize I'm asking the wrong group because you're all the people who took the time out of your day to participate in this town hall. So, how do you reach the people who don't want to be reached is always going to be a somehow unsolvable conundrum.
Hey, Harry, just to jump in there. So we used to do this member survey. I mean, yeah. as you're talking, I guess the idea that comes up, at least in my mind, would be to proactively survey the network and follow, and you don't always get good response rates, but sometimes some persistent bugging and nagging can help.
Yep.
And we did get some, anonymous, both good and bad, that was insightful, at least in the first year. I don't know if we did it in the second year, but I don't know if you've had thoughts about that.
Yeah, I mean, certainly another survey is something we can consider. That's the kind of thing I put into the category of, again, relatively low cost in terms of the effort, possibly low payoff, in the sense that you never know who's going to respond. I do also have a little bit of a fear of sort of over surveying and over nagging people. These things tend to lose efficacy as they get onto the nth time through, but it's certainly something that we could consider.
Yeah, I see what you're saying. Also, I don't know if it's, I think it's a universal problem, as you already alluded to get community feedback on what you're developing as a coordination center. I think you're not the only coordination center with this conundrum.
Yeah, well,
I'm also wondering about qualitative work, maybe focus groups or other types of things, maybe at the annual meeting or other places where people are already going to gather. But yeah, it's not an easy answer.
Exactly. So one of the other things that we do have planned, which I'm hoping to start perhaps in June or July, would just be sort of an occasional, perhaps monthly office hours where I will essentially set up an open Zoom link and be happy to chat with anybody who wants to stop by and talk about anything related to the network. Again, nice things about office hours for anybody who's been faculty and taught undergraduates. If you have office hours and nobody shows up, you get your work done. And if I have office hours and people come and have something to talk to, then so much the better. That shows there's a concern that I can address. So we will likely be starting with that soon. We're probably also going to try to throw out another one or two of these town halls in the future, and give folks a chance to show up. And again, as long as people show, I'm happy to keep doing them. I don't expect the same folks to come again and again. And if I schedule a town hall and nobody shows up, then nobody shows up. There's not really a lot of a loss there. So happy to take other suggestions though as we go. We've heard a lot of good things this hour, and that's exactly why I recorded. We'll put this up on the Midas site as well, so people can review it later. Other folks who couldn't make this hour will see it. But I'm going to wrap up in a second unless anybody has any further final comments to make.
Hello, Professor.
Yes.
Hello.
Yes, go ahead, Remy.
Yes, I was saying something about, I said I would like to go in deep because I'm a mathematician from Nigeria.
Mhm.
I'm working on infectious diseases, but I want to go in deep. You've not really answered my question about the mathematical aspect of what I said. I want
Yes.
to go into the area of stability and other things. I think you've not, I will need assistance in those areas. I would like to go in deep in testing for stability of these diseases. Yes, in testing for stability of these diseases. So I need materials that you can recommend. I would like you to recommend the material for me, or I need assistance in these areas.
So
Yes.
again, I'm probably not the person to give you the specific answer to that question, which is perhaps why I didn't answer it. But that
Okay.
said, I mean, if you can formulate a question and send us an email.
Okay.
I gave you the address. Maybe one of the things we can do is to put that out into our weekly update as a request for assistance. And we'd be happy to send that out. And again, I will see what we can do about thinking about this additional fora, whether it is some sort of a request for collaboration or something like that. Some pages on the site that could help with that might be worth pursuing. So we'll see what we can do. So please
I will get in touch.
And we'll see how we can help.
Okay, I will send a mail. I will send you a mail, sir. Thank you very much.
Okay, and with that, I think I'm going to wrap up. One more thing.
And one other thing, sir. And one more thing, sir. Yes, in most of these models are very complex, and solving them analytically becomes an issue. Solving them analytically becomes an issue. I'm thinking, is there software? Because I've been using Maple and other software. Are there other softwares that are more user-friendly than all these Maple that I've been using before? Because I've been using Maple, mathematical and other things like that. So I'm thinking, are there other softwares that can solve all these complex equations at a go? Thank you.
It's a great question. I don't have a good answer to that for you. My understanding is most of the people that I know of who are writing code are doing things similar like that. They're using R, they're using Python, they're using MATLAB to do their models. And that comes with all of the usual challenges that those languages face. But that is a great question. Again, happy to try to distribute that question for you if you can formulate it for me.
Okay. I will do so. I will do that. Thank you, Professor.
You're very welcome.
Sir. Yeah.
And I want to then just to wrap up, say thanks to everybody for taking the time and coming. We are always happy to get questions. I put the address questions at midasnetwork.us is the email address for the network. If you want to get me, if you want to send email to me directly, I'm harry@pitt.edu. I'm happy to hear from you. And we hope to see you, at least many of you, at the Midas meeting in September in Bethesda. And please look at the Midas Network update for news of forthcoming events such as this one. And thanks for taking the time. Take care all.